1 in 100. That's how many people live with the diagnosis of schizophrenia. Start counting family and friends, and the true number of those affected is much higher. Tonight, you'll meet someone with schizophrenia and learn about living with this brain disorder. That's coming up right now on Speak Your Mind. Welcome to Speak Your Mind. I'm Dr. Carolyn Phelps, licensed psychologist with the Human Development Center. Tonight, we're taking your questions on schizophrenia, and as always, we depend on questions from you, the viewer, to help explore this issue. So call the numbers on your screen right now. Locally, dial 218-788-2844 or call toll-free at 1-877-307-8762. And we're high-tech here, so you can also text us your questions or email them using the number or address listed at the bottom of your screen. We're going to be mixing things up a little bit tonight. We're going to have two guests on, take a little break, even though we're public television, not too long of a break, then come back for two more. We're going to introduce our first guest. Eric Spaeth is a professional artist who specializes in functional ceramics and who graciously comes to us tonight to talk about his personal experiences with schizophrenia. Deb Holman works with the Homeless Project through the Human Development Center as a street outreach worker. Thanks to both of you for being here tonight. I really appreciate your coming in. And Eric, I really appreciate your willingness to come in and tell us your story. And so I think you would be, of course, the best person to start off the show for us.
Appreciate it. Thank you for having me.
Absolutely. And so tell us the story about your journey both into schizophrenia and then into recovery.
Well, I think my journey, Carolyn, really began 16 years ago. I began as a professional ceramic artist. I brought a few paintings in. Those are what I'm concentrating on now. But the journey incorporated 10 years of quite a bit of strife and health issues, trying to deal with sort of a changing outlook that I had to adapt to in order to make it back to painting professionally again. So,
tell us a little bit about that strife that you mentioned.
Most of my organizational difficulties began to affect some of my productivity in ceramics, particularly right away. I wasn't painting again at the time and began experiencing in the ceramic process certainly some distractions and thought processes and things of that nature. And so gradually I've had to learn how to deal with a number of health related opportunities is how I see them. Do I eat correctly? Do I exercise my mind, reading, and organization? Can I take advantage and bring some of those colors that are street experiences back to the paintings for my viewers? So I'm trying to paint a picture just like you are this evening. So.
And when you were talking about having problems with organization, you were really talking about kind of your brain and your thinking becoming a little bit more disorganized. Is that fair for me to say? Or
I think that's, it's a fair observation. Disorganization takes a number of avenues, but certainly if we were going to isolate it down for 5 or 10 minutes for us tonight, distractions mentally were, a huge disorganization in trying to create a professional career that's certainly solo and private. So I'm creating my own checks every day, writing my own check, and that's not a good place to be disorganized. So.
Probably not. Yeah. And that led you really to a place for a period of time of being homeless then.
I was the last 2 years, and that's where I met Deb. She was gracious enough to intervene. She must have seen something. I don't know if it was talent, but she saw a gentleman struggling to continue that 10 years of career opportunities and make it into a career of painting and professionality that can be seen in museums. And that was difficult for me health-wise to organize. And I'm still working on organizing to reaching that museum level. So, but Deb certainly intervened in 2 years worth of street living. So,
and I want to get to Deb in a minute here. In that 10 years, had there been a diagnosis? Had you gone to somebody and somebody said you have this thing?
I have 2 diagnoses actually. I have one that I have followed for the last 10 years and sort of a repeated new diagnosis again. One is an orthomolecular approach, and which concentrates and really allows my organizational skills to address my health issues physically and immediately. And the other is schizophrenia too, certainly from more mainstream professionality that can see a need to address some of the mental organizations that I think you're touching on too. So,
and so tell us a little bit about how it is that you met Eric, and I'd like to hear also like a little contrast between the Eric you met then and the Eric who we see now.
Just there's a 180-degree turnaround from the first time I met Eric. I've been doing outreach for HDC on and off for 6 years, full-time for the last 4. And Eric came to us about, I'd say, October last year. And he's been in Duluth before, unwilling to use shelter services. Not the Eric you see today, not really willing to have a conversation. Really, if you wanted to talk with Eric, you could offer him a cup of coffee and meet him at the local coffee shop. But so we would just look for him in the community, myself and some other workers from the Homeless Project. I think most of the contact was with me. Many nights spent at the brew house, talking with Eric and going over his artwork, etc. He was misunderstood, I think, a lot in the community, barred trespass from a lot of different coffee shops and facilities because people were afraid of his behavior, which was, it was his illness, and he actually ended up being arrested and taken to jail. So, and at that time, a commitment, Rule 20, was ordered, and the process. Really, Eric belonged in the hospital, not in jail. He spent 3 months in jail and really decompensated in jail. But the end result is the Eric that's sitting here today. So, doing artwork again and, very productive, keeping his appointments, very clear and articulate in what he's saying, recommunicating with his family. His mom's been up to visit. I think, reconnecting with old friends, old connections in his working world. But when Eric was on the streets, it was 30 below, and he wouldn't even accept a sleeping bag. So there was like sleeping bags stashed all over town for Eric, but I think he just walked the streets at night and was trespassed from a number of places, basically just due to his illness,
That must have just been a frightening time for you as I listened to it, was it?
Well, it was frightening in the sense of, one, warmth, when 30 below, 40 below down by the lake. But I think for me, clearly being arrested is a very frightening situation, but frightening were my career opportunities and goals that I felt were slipping away, and especially not financially, which Deb has helped me address. Financially having to deal with the fact that I need immediacy for funds for things that are health-oriented, for eating correctly, but then also some community outreach has enabled me to organize and develop some funds for paints and things like that that are pretty expensive. So.
I kind of like what you just said, though, when you were explaining, when I said that sounds pretty frightening, and you corrected me, rightly so, I think, really, by saying part of pointing out that part of also what is so frightening is that here you were on this career path, you saw yourself already as a successful artist, and you were watching that kind of slip through your hands for a period of time and not being able to realize what you knew that you could do for that period of time, which is maybe as frightening as
right.
being on the street?
I think you're correct. You know, for me, the slipping in you know, living conditions and then professional conditions began after that was probably the most difficult for me, and it allowed some bravery, and you know, bravery, if you want to call it that, in refusing, you know, some sleeping bags and necessities that probably anybody else would have seen. But Deb continued to pursue me, and another number of other individuals as well, you know, in trying to address this warmth issue and a community issue that lent its opportunities to me to pursue my career goals again. So.
And what is it that you would like to say to the viewing audience? What do you think the take-home message for them should be?
I think for me, the issue when you address like things slipping and some of our community skills not being having the ability to address those fully, I think for me, I would just like to encourage people on both ends of the rope to help and lend the abilities they have, whatever that ability is, whether it's to allow me to be centered again, to allow me to pull my professional abilities up to help the community again, and hopefully then the ropes start swinging around and I can lend hands again. So.
And Deb, what would you say is the take-home message here?
Well, I think, you know, when Eric was deep in his illness, what I've seen is, you know, it's always hard when you're meeting with him in that, when he's so ill like that, to like really piece together what's truth and what isn't. And come to find out that, you know, most of the things Eric pieced together, even though he didn't have the full story, he had a good recollection of what, you know, of all the events in his life. He just could not organize his thoughts to put it all together. So a big change in that regard, and just him being able to stay in one spot, and you know, everything he said was true. It just did not piece together, like you know, the fact that he's, you know, all the stuff that he's done in his life. So and Eric actually was an easy one. It's not always that easy to engage people. Sometimes it takes years. So the community intervention was helpful in a sense to get him back on track.
Absolutely, and to have the whole community involved,
right.
and a community that's compassionate, right? A community that's compassionate towards all its citizens. I thank you so much for coming on, both of you, Eric and Deb. And we're going to take a break and come back with 2 more guests. Welcome back, and now we continue our conversation on schizophrenia with Dr. Steve Bauer, who serves as the medical director at the Human Development Center and is board certified as a child, adolescent, and adult psychiatrist. And also with us is Jim Gruba, who's a licensed psychologist with the Human Development Center. For over the past 40 years, much of his experience has been working with individuals with significant mental health issues, including schizophrenia. Thanks to both of you for being here this evening.
Thank you.
I think a good place to start would be to get everybody on the same page and talk a little bit about the symptoms of schizophrenia. Dr. Bauer.
Schizophrenia composed of basically 2 kinds of symptoms: positive symptoms and negative symptoms. Positive symptoms have been described since the 17th century or before. These are hallucinations, delusions, paranoia, disorganization of thought, and problems with maintaining your trajectory of being adequate where you think you were and continuing your social progress are more of what we call these negative symptoms. So it's a combination of these two things that usually becomes fairly debilitating unless it's treated.
Which is kind of what we heard from Eric then, the disorganization that he talked about in his thinking that interfered with his ability to do his artwork, and then that isolation and that deviating from the trajectory. I feel like this has become a talking head show, hasn't it, here? In a heartbeat, we managed to do that.
Just that quickly.
Just that quickly. Risk factors for the development of schizophrenia.
Well, there's a lot of research yet to be done on schizophrenia, and we know that it develops usually in late adolescence. And why does it develop in 1 out of 100? We don't know. We know there's a genetic factor because if it's in the family, there's a higher risk. There's an assumption or a belief that stress can trigger the illness, that it's sort of waiting there to happen like other illnesses we know about. And so I don't know that there's much to be said about preventing. There's a lot to be said about early intervention. It can be difficult to recognize that this is schizophrenia because lots of things happen with teenagers in terms of your life is changing, you're growing up, you're making decisions. Other things are happening, so there's often a lot of confusion about what's going on when somebody starts developing the symptoms of schizophrenia. But we do know that early intervention is important in terms of good treatment and stopping that trajectory, use that term again, to stop the progression from becoming as serious as it can. Because we also know that over time, the more times somebody's had an episode, the more times they've been in the hospital, that makes things more difficult. So aggressive treatment is really where we're headed now in the field.
And in fact, and this is the perfect segue, and if I don't mention this, I'm getting lots of calls and mail tomorrow. We are involved in a national study on early intervention with schizophrenia. Tell us a little bit about that.
Correct. The RAISE project is trying to determine the difference between early and aggressive intervention and standard care. We are a site that's taking part in this. We still need some folks to be part of it, and so anybody that is in the first 6 months of experiencing problems like this, there's an opportunity to take part in helping us understand more about this, and calling our center would be a good start to that if that was happening. But really, in terms of the research, there have been several folks that have tried to suggest the earlier and more aggressively we treat, the less likely it's going to be a more severe chronic problem. It was described as though cancer, which if you wait and detect it late in stage 3 or 4, quite often is a terminal illness, whereas if you catch it early, quite often you can prevent the more serious complications.
I think that's an excellent analogy, and you know, preparing for the show tonight, one of the things I did was, do what we all do now, which is Google, and on my blog, because you're going to want to check this out, I'm going to give you the New York Times site to go to, because there is an interview there with several people who are pretty high functioning with schizophrenia, including a woman who was a law professor at a prominent law school in the United States. And this kind of gets at that whole early intervention, perhaps leads to a life where you're able to kind of get back on the trajectory, maybe.
Well, and that's, the movie A Beautiful Mind was really chronicling a little bit of stylized version of what happened with John Nash, who was a PhD Nobel Prize winner in economics, who didn't get very early or aggressive treatment, at least not very helpful, partly because he was born a little too early for some of our newer treatments now, but a compelling story.
And Dr. Bauer may add or correct me on this, but we also know that some people respond very well to medication and other treatments, and we may never see them in a sort of a long-term care setting, and others we know that are going to need some ongoing care and treatment over the course of their lifetime, and our job is to help provide the best care and create the opportunities so that the Erics of the world can get back out there and do what they want to do.
Absolutely, and paint some of those beautiful paintings. Here's a question from Bovie. Can you become catatonic from schizophrenia?
Catatonia is one of the things that's associated with schizophrenia.
And tell us what catatonia is first.
Catatonia is essentially becoming waxy rigid, which means you adopt a posture that when someone moves your arm, you tend to be so stuck and so removed that it just remains there. It's a very fascinating piece in terms of having only seen a couple of people with it. When one gives them a certain kind of medicine, it goes away almost immediately in most cases, but it's a version of what can happen in the most severe versions of schizophrenia.
And pretty rare these days.
It really is, because of the early treatment and more people being on treatment.
Here is a question. Are auditory and visual hallucinations a sign of schizophrenia?
Those are the two most common, and certainly auditory is probably a bit more common than visual. Visual, when I was in training, sometimes talked a bit more about metabolic kinds of disturbances, most primarily alcohol hallucinations, but certainly there are lots of people with schizophrenia who have both.
And how about schizophrenia in childhood? Not adolescence, but in childhood. Seems to be a little controversial, maybe?
Well, certainly it's much more rare, and the parts of childhood that incorporate fantasy are sometimes mistaken for people having hallucinations or seeing or hearing things. And there's a lot of cultural issues that factor in when you really try to tease apart the subtleties of someone who's experiencing unique experiences of whatever sort.
And Jim, you've worked for a long time, as we said at the beginning of the show, in this area. Tell me what you've seen just over the years in terms of what's been helpful for people with schizophrenia. What do you see as being...
Well, we've seen a lot of changes. 40 years ago when I started in the field, I first started working in Chicago, and this is not an exaggeration that often people were discharged from the hospital, which was one of the few places to get treatment, and kind of to the end of the bus line, and then somehow make it in the community. And I first started working at Thresholds, which was a rehabilitation center, and a model that other programs have copied or modeled themselves after, where a lot of support. And one of the things that appealed to me about the field was like, well, okay, here's an opportunity for a job where the most valuable thing you can do is be another human being. So, and taking that and spreading that out, or carrying that out into what we do today, we do a lot of services in the community, kind of alongside the person. We've got the doc doing some prescribing, we might have a therapist doing some other work, and we have a whole lot of folks that are available out in the community, helping people with basic needs, helping people navigate the world at the roughest times. And so providing that community support, I think, is one of the most useful things that's evolved over the last 40 years.
Here's a question from someone in Duluth. Do symptoms worsen with age?
Not always. The typical course of schizophrenia has been described mainly as waxing and waning. When I was in training, we talked about a third and a third and a third. The first third might get ill and then recover fairly well. The middle third would get ill and have some persistent symptoms that they would be able to function to some degree with. And the last third would have very persistent, very difficult symptoms that quite often led them to be in the hospital or homeless or needing lots of help chronically. And the medicines aren't always very effective for some of those folks.
What do you think the take-home message should be? I asked Deb and Eric what the take-home message should be. Jim, what do you think the take-home message should be here?
I think the take-home message is and we haven't really talked about this yet, but I think one of the biggest challenges is that front end, recognizing what's going on and coming to terms with it. Schizophrenia for most people is a horrible disease. And so for the individual and the family to come to terms with it and then move forward with whatever the best thing to do is a very big deal, very hard.
A process.
And so I think the work that's been done to help people recognize that this is an illness, this is something that's good to address, okay to address, there are ways to address it. I think that's the take home that I would put out there.
And that with help also, people can return to a level of functioning and to have a life worth living, and a life in recovery. Then I think as we saw with Eric here, and the work that he's doing, we are actually at the end of our show tonight. That's how quickly time goes by. I think that you have seen here a face, one of the faces of schizophrenia, and we thank Eric again so much and being so gracious in coming here and sharing his story, so that you can see what a face of schizophrenia looks like. And I think that that's important as we begin to demystify what this thing is of mental illness. Don't forget to visit us on the web at speakyourmindonline.org, where you can find a schedule of our topics, as I say every week, and resource links, and read my blog, the place where I answer more of your questions and where you'll be able to see information about RAISE and getting involved in that study if you're eligible. You can also email us your questions about next week's show, when we'll be talking about attention deficit hyperactivity disorder, commonly known as ADHD. See, I kind of did it right then when my brain got ahead of my mouth. I'm Dr. Carolyn Phelps. Thanks for watching, and good night.